Good day, Doc. We are here to report to you a case entitled The Impact of Diabetes Related Dry Eye Syndrome on the Quality of Life of a 65-year-old geriatric female patient. So, our group consists of Jam Gerard Gonzalez, me, Scott Layton Villamore, and Earl Rod Vivares. So, to start off, we have here the abstract. So, diabetic-related dry eye syndrome is marked by persistent eye dryness, worsened throughout the day, leading to visual disturbances, increased susceptibility to infections, and delayed corneal healing. So our case involves a 65-year-old female with type 2 diabetes reported itchy, irritated eyelids, dryness, and gritty sensation in her eyes. So we evaluated her through breakup time and Schirmer test, revealing tear production of 8 millimeters in the right eye and 6 millimeters in the left eye, indicating a poor tear production. So the Maybography indicated over 75 gland loss based on the Maybog scale. This case underscores the importance of detailed diagnostic assessments for managing dry eye in diabetic patients. So, what is dry eye syndrome? Dry eye syndrome, also known as keratoconjunctivitis sicca, is characterized by insufficient tear production or poor tear quality, leading to symptoms like dryness, irritation, burning, and blurry vision. It affects 10 to 30% of older adults, with rates reaching 50% in those over 65 years old. So, it is more prevalent in geriatric patients, no? Especially with diabetes, particularly type 2, significantly increases the risk of dry eye due to diabetic autonomic neuropathy, which impairs tear production, and chronic hyperglycemia that damage nerves and blood vessels. So, research indicates that diabetics are 3 times more likely to experience dry eyes, especially elderly patients or geriatric patients. So, also, additionally, medications for diabetes such as metformin and insulin can further reduce the tear production, compounding the risk of dry eye in this population.
Okay, so for the patient summary, our patient is a 65 years old female, and her chief complaint shows that there's a symptoms of a sandy, gritty sensation and dryness in the eyes. Next. So for the past ocular history of our patient, she had a cataract surgery on her right eye at November 2014 and on her left eye January 2019. So for the past medical history, she had a hypertension, mild, and type 2 diabetes mellitus. It is well controlled on medication since 52 years of age. So for her medications, she had Amlife for hypertension or high blood pressure, Diamicron for non-insulin dependent diabetes, and Diamaxin for glycemic control, and lastly for supraneuron for vitamin B complex for her nerve health. So for the family medical history of our patient, the mother side of the family had history of diabetes and foot or slash leg amputation. For the family members, the brothers and sisters have diabetes and also controlled with medication. So for her social history, main occupation involves housekeeping and laundry attendant, non-smoker and non-drinker. So for the ROS, she's negative for Sjogren syndrome, no new CNS, heart, lung, GI, skin, or joint symptoms. So for her ocular examination, her current prescription for both of his eyes both of her eyes are plano and add 2.50. For the visual acuity on both of her eyes, both distance with correction and without correction are both 20/20. So for the right eye, for near VA, without correction is J2, while sa left eye is J3. With correction na pod sa near VA is J1 and sa right eye, so sa left eye kay J2. So next is the unilateral cover test. Both of her eyes, both far and near, are orthophoria. So for the alternating cover test, both of her eyes and both far and near are both exophoria. So sa pupil reflex na pod, there is both of her eyes are perla and minus negative for RAPD. Sa external examination, both of her eyes shows arcus senilis, which is also white-blue ring around the cornea. So for the confrontational visual field, patient counts finger in all quadrants in both of her eyes. So sa keratometry na pod, sa right eye, plano ra. So sa left eye, minus 0.75 cylinder axis 90 and against the rule. So another test, motility test, both of her eyes are smooth, accurate, full, and extensive. Sa Hirschberg test, both of her eyes are centrally located. Sa Amsler grid, kay both of her eyes within normal limits. So sa slit lamp examination, her eyelashes in both of her eyes are outward and thinning. Sa eyelids, droopy, loose eyelid skin. And conjunctival sac, both of her eyes are decreased, tear meniscus or less than 0.2 millimeter. Sa bulbar conjunctiva, both of her eyes shows dry. Plica semilunaris, both of her eyes are irritated. Sa limbus, light blue ring, both of her eyes. Cornea, hazy rings on the outer region both. So sa sclera, shows that both of her eyes shows redness. Sa TBUT, sa yung right eye, 7 seconds, while sa yung left eye, kay 8 seconds. Sa anterior chamber depth, both of her eyes kay grade 3. And iris, both dark brown. So sa ophthalmoscopy, sa media, positive siya sa red-orange reflex, both of her eyes. Sa CD ratio, 0.3 millimeter. Sa margin, both are indistinct. Vasculature, 2:3. Sa macula, there is no signs of drusen. And sa background, kay both are clear. So more tests are performed, such as color vision test. On her right eye, 10 out of 12 ang yung nakuha. Sa left eye, 11 out of 12, while both of them same sa both eyes OU. Next is the contrast sensitivity test. All of them shows 1.80 log unit. So for our Schirmer tear test without anesthetic, siyang right eye, 8 millimeter, wetting of the paper after 5 minutes. And sa yung left eye, 6 millimeter, wetting of the paper after 5 minutes.
So today I'm going to discuss the pathophysiology of the case study. So we will run through what is the diabetes mellitus, chronic hyperglycemia, structural damage to the lacrimal glands, neuropathic and microvascular complications, tear reduction, corneal sensitivity, clinical manifestations, and lastly, the impact of quality of life. So let us proceed. So what is diabetes mellitus? So diabetes mellitus is a long-term chronic condition where the body does not produce enough insulin or properly use insulin, causing high levels of blood sugar. So over time, these high levels of blood sugar can greatly affect or damage various organs in our body, including our eyes. So when high blood sugar or high levels of blood sugar arises, this can lead then to dry eyes. Then next is the chronic hyperglycemia. So when blood sugar stays for a long time, it can trigger harmful effects to the body, including our eyes, This would cause inflammation and damage to the blood vessels, causing dry eyes. So after that, no, is the structural damage to the lacrimal glands. So as we all know that the lacrimal glands is responsible for producing tears in the eyes. So when there is high levels of blood glucose, this can harm the lacrimal glands. This result to not produce enough tears. This then can lead to dry eyes. Then next is the neuropathic and microvascular complications. So diabetes can also affect the nerves and small blood vessels in the body. So nerves that control tear production gets affected, leading to reduced signals for tears and oil producing glands. With this leads to fewer tears and oils, worsening the dry eye. Next is the reduced tear production. So with the tear producing glands not working properly, fewer tears are made. This results in dry eye, where the eyes don't have enough moisture. Then this makes the eye feel uncomfortable, gritty, and irritated. Then let us proceed to the reduction of corneal sensitivity. So the diabetes or high blood sugar also reduces the sensitivity of the cornea, or which is this front surface of the eyes. So when there is damage in the nerves, it makes harder for the eyes to respond to irritants and less frequent blinking. Then this worsens the dry eye. After that, dry eyes caused by diabetes can result to symptoms or clinical manifestations such as dryness, burning sensation, blurry vision, irritation, and a gritty feeling. So these symptoms can vary in severity but often cause ongoing discomfort. So that is the pathophysiology of the case study. Then next is, let us proceed to the differential diagnosis of the study, which consists of 3 conditions that contribute to dry eye symptoms. So first is the diabetes related dry eye syndrome, the Sjogren's syndrome, and meibomian gland dysfunction. So each condition has its own underlying cause and impacts on tear film, which can help us guide the diagnosis and treatment. So first, let us look at the underlying causes of each condition. So with diabetes-related dry eye syndrome, this happens because of diabetes, which can damage nerves and blood vessels that control tear production. So when the tear glands don't work well, the eyes produce fewer and low-quality tears, causing dryness. So for Sjogren's syndrome, on the other hand, it is a autoimmune disorder which the body's immune system mistakenly attacks its moisture-producing glands, leading to dryness in various parts of the body, most notably the eyes and mouth. And lastly is the meibomian gland function, which occurs when the meibomian glands in the eyelids become blocked or inflamed. So these glands secrete oils that are essential for stable tear film. So without proper lipid production, the tear film becomes unstable, resulting in evaporative dry eye. Then next is the patient demographics. So understanding which patient are more likely to develop these conditions is also the key. So first is for the diabetes-related dry eye syndrome. This is most commonly seen in older adults with diabetes. Then for Sjogren's syndrome, this tends to affect middle-aged women. And any of kanang age, this can occur also in men and people with other age groups as well. Then for the meibomian gland dysfunction, this can affect people of any age but is more prevalent among older adults, likely due to age-related changes in the glands. Then next is for the clinical manifestations or the symptoms. So each of these conditions shares some overlapping symptoms, but there are distinct differences as well. So first is the diabetes-related dry eye syndrome. So symptoms include dryness, burning, fluctuation of vision, and irritation. So in patients with Sjogren syndrome, they can experience persistent dry eyes, but often have systematic symptoms as well, such as dry mouth, fatigue, and joint pain. Then for the meibomian gland dysfunction, the symptoms are primarily dryness, irritation, redness, and blurring of vision. Then next is for the tear production, which is the ability to produce tears is different in each condition. So first is the diabetes-related dry eye syndrome. So tear production is reduced due to autonomic neuropathy and lacrimal gland dysfunction, which hampers the production of water components of the tears. Then for Sjogren's, this causes a significant reduction in both tear and saliva production due to autoimmune attack in the glands. In contrast with meibomian gland dysfunction, this often presents with normal tear production, but the issue is it lies with the quality of tear film, particularly the lipid layer that stabilizes it. Then for tear film stability, which is the stability of the tears, is a crucial factor in dry eye conditions. So for diabetes related dry eye syndrome, there is aqueous deficiency, so meaning the eye doesn't produce enough watery tears, leading to poor stability and evaporative dry eye. Additionally, changes in lipid composition may further contribute to this instability. So for Sjogren's, tear film is unstable and is primarily due to decreased production of both watery and mucin components of the tears. Then for meibomian gland, evaporative dry eye results from altered lipid composition. So the meibomian glands fail to produce enough oil, which leads to rapid evaporation of tears. Then for the associated condition, let's touch some other conditions that are commonly seen with this diagnosis. So for diabetes, this is often coexist with other diabetes-related complications such as neuropathy and retinopathy. For Sjogren's, it is frequently associated with autoimmune disease including rheumatoid arthritis and lupus. And lastly, for the meibomian gland dysfunction, it is often seen alongside with skin conditions such as seborrheic dermatitis and rosacea. So in conclusion, each of these conditions affects the eyes in distinct ways. So understanding the key differences in etiology, demographics, symptoms, tear production, and associated condition is critical in making an accurate diagnosis. So tailored treatment based on the specific cause of dry eye can greatly improve the patient's outcomes.
For the management plan, first off, we have preservative-free artificial tears. So these eye drops, specifically designed to lubricate the eyes without containing preservatives that could potentially irritate or damage the ocular surface with frequent use. They are often recommended for individuals with moderate to severe dry eye or those individuals who need to use drops several times a day. So these artificial tears mimic the natural tear film and help relieve symptoms such as burning, irritation, and discomfort by maintaining moisture on the eye's surface. Next off, we have omega-3 fatty acids. So diet, diet, dietary supplementation with omega-3 fatty acids like fish oil can help reduce inflammation and improve the quality of the lipid layer of the tear film, which reduces tear evaporation. Omega-3 also supports overall ocular health by enhancing the function of the meibomian glands, which are responsible for the oily components of tears. And lastly, we have here warm compresses. So applying warm compresses to the eyelids help to open the meibomian glands, which may be blocked or dysfunctional in dry eye disease. So this promotes the release of oils that stabilizes the tear film and prevent rapid evaporation of tears.
So for the conclusion, a 65-year-old female with diabetes-related dry eye syndrome highlights the importance of comprehensive care, early detection, and patient adherence to treatment. Persistent symptoms and diagnostic findings, such as reduced tear production and significant meibomian gland dysfunction, emphasize the need for regular assessments to prevent complications like infections and delayed corneal healing. Effective management, guided by thorough evaluations, is crucial for symptom relief, preventing further damage, and maintaining vision and quality of life. Thank you.